Good afternoon, everybody. And as all of us are aware that DMTs are very crucial for treatment for multiple sclerosis, we are interested in having a easy access to DMTs. Next slide, please. So this is what is a basic. I don't have to actually mention about this more about this because all of the audience is aware about this. Please next slide, please. Yeah. So now we are looking at accessibility of DMTs in India, and in this case, we are having this various DMTs which are mentioned here. Actually, this presentation will be available for others also afterwards. So these are readily available, all these DMTs in India. So I just wanted to put it there. And as far as the availability of DMTs is concerned, next slide, please. Yeah. So now we are looking at most important thing is accessibility of this DMTs. Accessibility is important in a way. There are three issues. One is affordability and availability. As far as availability is concerned, we are having proper availability in India, but affordability is a big issue. In India, we are having most of the patients have to pay for their own treatment. This is different from many European countries. Insurance coverage is less than 20% of the population, even after considering government employees who are covered under CGS scheme. So huge out-of-pocket expenses is required to be incurred, and 80% of the care in India is provided in the private hospital. So again, there where people have to pay out of their own pocket, and there the cost of the DMTs is very important for patients. So in case the prices are not affordable, it is as good as access denied to many patients. So if you see in second column, the accessibility of the moderate efficacy DMTs is not big issue in India, but availing higher efficacy DMT is the challenge. Even I am told that even most of the higher efficacy drugs are also available, or they can be easily imported. But price is the main factor, making affordability is actually constraining factor for access to the medicine. Most PMW, as mentioned, they have to pay out of their own pocket. In one of the state, out of 29 states, Tamil Nadu is giving around 15% of the people, persons with MS, are having benefit of getting DMTs from government with the help of state chief minister's insurance scheme. So we are looking at even improving the access to insurance cover also. This is actually a slightly different subject, but it is also related. See, because accessibility is boiling down to affordability in India. And as insurance is also not covering those who are already diagnosed with multiple sclerosis, we are trying for getting insurance policy for multiple sclerosis patients and also getting them covered under the getting this DMT treatment also covered. But this is a faraway dream, frankly, because insurance companies are not willing to take it. Only recently, since last month, there was a insurance regulatory authority has mandated insurance companies to cover people with all the specified disability. There is slight deviation from the subject, but it is very relevant that multiple sclerosis is covered under 21 disabilities. That also started since last 2 years, that it is covered under 21 specified disability. And last 2 months, since February specifically, February 23, they have included, insurance regulatory authority has mandated people, government, these insurance companies to include multiple sclerosis also for insurance policy. But insurance policy, whether they will cover in so far only 2 companies have come out with insurance policy covering these 21 disabilities, including multiple sclerosis people. But whether they will cover DMT treatment or not is a long shot, to be honest. And we will be, I think, doing advocacy for this for coming years. So that is what is our just intention. So again, most important thing is in India, there is we have essential medicines, the medicines list, which is covering having covered in 27 chapters of all the essential medicines which are mandated in essential medicine list. There are roughly 284 medicines which are covered under that list. And this list was last updated in September 2022. And we will be, unfortunately, in this multiple sclerosis treatment, none of the DMTs or any drugs which are required for multiple sclerosis treatment are covered in that. So once I am really hoping that the MSI will be able to get this our DMTs classified in EML of WHO, we will be immediately taking it forward. Of course, that is there in my next slide. Joanna, please, next slide. So as far as DMT's classification is concerned, we have these 3 classifications: moderate efficacies, the moderate high safety therapies, moderate to high efficacy therapy. Then all these drugs are mentioned specifically: interferons, beta interferons, latimerate, etc. And all these are mentioned. Of course, you will be getting this presentation also. We are having in India all these drugs. Again, I am repeating, as far as all these DMTs are concerned, we do have these drugs. Yeah. So, John, earlier slide, please. I think there is one more slide. No, please go ahead. Yeah. So now, as far as support from MSIF, WHO EML application, what this one will be, how it will be benefiting. Listing of DMTs on WHO EML creates a tool for awareness raising and advocacy. It is the WHO level stamp of approval. See, this is very crucial in India. Unfortunately, none of MS medicines or DMTs are coming under essential medicines list, where price control is there and government is specifying upper price limit. So it is none of those are there right now. But the moment it is coming on this EML list, WHO EML list, what will happen is we will be advocating that to Ministry of Health and even Drug Pricing Authority that these are the medicines which are essential for multiple sclerosis and do include these things on essential medicines list. So that will be giving us a lot of booster. The listing of as it is will formally acknowledge MS as a global health concern. And in India, unfortunately, MS is virtually a rare disease. And people are not aware. Many times even doctors are not aware. So that will give us, once it is listed, even in EML, essential medicines list in India, it will be definitely leading to a lot of, I would say, awareness amongst medical fraternity and also other related government bureaucracy. There will be beneficial for spreading awareness about its prevalence in India and also hardship faced by people affected by it. See, once we'll be able to represent to Ministry of Health. This is the line of thinking what we will be looking at. And Ministry of Finance for reduction of custom duty on various DMTs which are directly imported or the intermediaries which are being manufactured in India. For that also we will be putting forward in an advocacy way. And substantial, ultimately our intention is substantial reduction in prices of these DMTs for improving affordability and results in accessibility treatment of MS. I will give you a perspective. If you see, our national per capita income as of now is only $2,200 per annum. Roughly, this is what is coming. In spite of having ours is the sixth richest economy, if you see globally, we have some significant inequality in India. So, in spite of having large GDP and sixth richest in world, still we are having only 2,200 rupees per capita income per annum. Because of that, if you see the DMT's cost, if we compare various DMT's prices, which are running into lakhs of rupees, with at least, I will have detailed prices also sent to those who are interested, because what prices we are having, they are very, very high for the annual supply, and this is virtually making access impossible, not only difficult for most of the patients. See, because in India, the government system, hospitals and medical support system, which is available for many of the many poor people, their per capita income level is restricted, and middle class people are having no option to go for their make payment out of their own pocket. And because of this, many people do not even start treatment because it is simply not affordable to spend 25-30 lakh rupees per month, per annum, where the income is hardly 2 lakh rupees, if you see in Indian context. So 2-3 lakhs rupees. So then it is becoming very difficult. So Joanna, please put the next slide. This is a concluding slide. What would be our next steps? As I mentioned, once DMTs for MS are listed on WHO EML, we will represent to government all the departments which are important for inclusion of DMTs on national list of essential medicines. MSSI will also represent to make DMTs available across India at affordable prices. And we will also represent for making DMTs available free of cost in government hospitals. Because government hospitals do provide many medicines free of cost. However, unfortunately, multiple sclerosis drugs are not there. That's all for my presentation. Thank you very much for.
Sandeep, I want to add some more. Sandeep, I want to add some more thing in that.
Yeah, please.
As you mentioned, availability is not a problem in India, but affordability is a problem. For example, when you take cladribine, only 1% is using cladribine. It costs 1.5 lakhs per year, twice a year. Twice in a year. So only 1% is using cladribine. When you take alemtuzumab, for example, Lemtrada, no one is using, and also ocrelizumab. All are very costly. No one is using these kind of DMTs. So our request from our side to MSIF is to make it availability is not a problem, make it affordable for everybody. And as Mr. Sandeep told about the 15% of government are providing DMTs, out of that none is higher efficacy DMTs. All are moderate efficacies, and moreover tablets form also. It is very sad that we don't have a protocol for MS treatment, as well as we don't have national EML for MS. That MSIF has to take it in their mind. That's all from my side, Sandeep.
Thank you. Thank you, Siva.
Yeah, so Sandeep, I would like to
Yeah,
say something.
Dr. Rekha, please. Yeah,
Yes.
I was waiting for your comments. Yeah.
Right in the beginning, before the newer DMTs were launched, rituximab was actually being used in patients of persons with MS, and rituximab was actually is on our national medicine list for under the cancer drugs. So actually, it was an extended use, extended line of usage that the MS patients could, the persons with MS could access at a lower cost. But we actually will need to make a very, very powerful advocacy to bring in the DMTs under the for MS persons themselves, so that it so that there won't be a line extension of drugs, that we're not using drugs which are on our list for other diseases, and because they make a difference in the treatment of multiple sclerosis, we are actually making use of those drugs. So I think you're absolutely right. What we need to do is to make our the DMTs accessible, available, and affordable for the persons with MS in our country, and that really is going to be our focus and our priority.
Thank you very much, Dr. Rekha, for your elaboration and stating that certain cancer drugs that is coming under research.
Yeah, can I make some comments? One is that, in India, the platform therapies are available in the, government hospitals, in many state government hospitals, because we have the generics. So the cost is quite affordable, I think, to many of the people in India if they use the generic oral medicines, DMTs, and they are available from many government hospitals. And rituximab, I think the problem is the availability is a bit irregular. The rituximab is also available in government hospitals free of cost, but it sometimes becomes non-available. It's very much intermittent availability, I should say.
True, sir.
So can I make a quick comment? So Tapas used it in Calcutta, and Mr. Chitnis and co are from Bombay, two large metropolitan cities. I sit in a small town, Mangalore, where though rituximab is mentioned as an anti-cancer drug, on EML, it's never available. It's not a question of being irregular. It is not available at all, period. Azathioprine, which is meant to be used for as an immunosuppressant for renal transplant, again, occasionally, rarely. So the effect of being included in EML does not necessarily translate across the country. So in larger cities, maybe you can make a difference.
Sure.
But and EML is available only in a governmental setting. And as you know, 3/4 of patient populations go to private doctors because the hospitals in rural India and the smaller towns are not good enough to have specialists. Ultimately, it is out-of-pocket spending, whichever way you look at it, for the vast majority. So, it's a difficult situation, but at least let's start the initial procedure of getting it included under EML for MS, and then we can instigate the local bodies to make the distribution more even. We could try something once it gets included.
Thank you, Dr. Rekha.
Sandeep, can I tell one more point, Sandeep?
Yeah, please go ahead.
As Dr. Rekha told about rituximab, and unfortunately, azathioprine is indicated for rheumatoid arthritis and IBS, and it is widely prescribed by most of the neurologists in Chennai, that means in India. So that also should be considered.
Okay.
And it is a tablet form. It is easily available in all government hospitals. And injections, Avonex is widely used by most of the neurologists. That also should be considered, Avonex. That's all from my side, Sandeep.
Thank you. Thank you. I just would like to mention, only add one sentence on this, is India is a vast country, and today itself, in some of the, I think today's news, now India has become the largest country with largest population, 140 million, 1.40 billion people. And we have diversity across India as far as cities and some villages or even smaller cities are concerned. So definitely there is a challenge in sometimes reaching also, and some practices are also little different. So that is always there in a vast country. That's all I wanted to say.
Thanks, Sandeep, and really interesting to hear from all of the different people from India on this call. I think it's been a really rich conversation.